everybody. Hello, my name is Jessica. I'm with the Avalon Foundation. And I'm here again with my friend Megan from Choptank Community Health. She's the Chief Clinical Officer over there. Megan, what are you seeing? COVID, right?
COVID. Thanks, Jess. Well, we are still seeing those positive cases across all of our health centers. But I do think it's the week of home tests. There, is that new website that came out where you can order tests, but there is some question about when they will actually be shipped to you or when you'll get them. And then there is also some more information coming out about how private insurance plans will cover up to 8 tests a month for people. So all of that's exciting, but we still have to kind of do what we can do to try to make sure we have those home tests at home at all times in case you need them.
Absolutely. And I think that there's like a gear shift that those of us who are able and have the test should start thinking about. I always have Advil on hand. I always have Tylenol on hand. Maybe you've got your NyQuil or Mucinex or whatever that's always in that medicine cabinet. We really need to move to a space where we have those COVID tests in advance, like that you're not going out because somebody's feeling bad, but that you have them on hand to be able to test when you should. And hopefully with the increased availability through the federal government and through insurance providers, we're going to be able to do that. There's been a lot of press about trying to ease the pressure on the medical system. And I like that you're saying that maybe we're at the top of the roller coaster, but you have mentioned to me that it could be a twisty, turny ride down. It's not a roller coaster that goes up and straight down. Maybe it's one with twists and turns. So what kinds of things can we continue to do to support the healthcare system in this time that is still so tumultuous?
Sure. So, it really comes down to, when you have such a high volume of COVID positive cases, a percentage of them are going to need that hospital level care. And we're just not built for that type of volume. And then you throw in staffing shortages and, positive staff. It's a real struggle. So, you have the people that are in the hospital that obviously we need to free them up so they can provide that hospital level care. And then we have primary care offices like Choptank where, we want to free us up where we can make sure that we're managing those chronic diseases and keeping them well enough to stay out of the hospital. But what you can do at home is, not only having those COVID tests at home in your cabinet, but you want to roll that out. And then, you again want to do it again 24 hours if it was negative. You want to wear the well-fitted mask and, do all those things that we know that will slow the spread down. Because if we keep these numbers up where they are, it's going to be a problem. And the other thing that, I think is important, the roller coaster goes up in a couple of weeks is what what we've seen in other countries and what we're seeing here in some states. But the way down can take several weeks, maybe about 5. And it's going to be some twists and turns, like you said. So, just because we might be at that peak and be on the other side, it doesn't mean that this is done or that there's no cases around.
One thing that Megan and I talked about last week when we were offline was one of the things that was really clogging up the testing system were employers who were requiring tests for various reasons. And one of the things that we talked about was how great it would be if you are an employer and you are able to have tests available for your employees. So hopefully, as we have greater availability, employers like the Avalon Foundation, we have some on hand for our staff, just making sure that, your employees are not part of the problem in terms of shaking you guys down for testing.
Yes, so the more that, anyone can do to manage this outside of sending them to their PCP is definitely the better. You can, as an employer, you can either stick to the 10-day and feel, good about that they're not going to bring it back and spread it after 10 days. If you want to consider the shorter 5-day, then, you have to either accept that there might be a low risk of them transmitting it after 5 days. So they need to wear that well-fitted mask. Or you can supply them with home tests, or if they can get home tests and you get that negative result, then you have more reassurance that they're good to go. But requiring excuse notes and getting testing to make sure they're negative, it is bogging us down.
Yeah, I'm sure. Talk to me about the flu. Are you seeing a lot of flu? Is it too late to get that flu shot? Is that something else that we can do to kind of ease the pressure?
Sure. It is not too late. And yes, flu is here. We are seeing some co-infections with COVID and flu as well. So definitely recommend, if you haven't had that flu shot, to go and get it. And that way, hopefully you won't get that co-infection.
That sounds great. It's been great talking to you again, Megan. We'll see you again next Tuesday. I hope you have an awesome weekend. And again, thanks for watching. We appreciate it. Bye-bye.